Hello, everybody out there in Facebook land. It's Dr. Raiders checking in from Raiders Spinal Health Center in Vernon Hills. We are checking in with Nikki, and Nikki has a great story about progress and change with her headaches and migraines. And I just wanted her to share a little bit of her story with you guys because I think when Nikki first started care, she didn't really realize that chiropractic could help her with something like this. And she's seeing some great change now. And I just wanted to talk about that for a second. So, Nikki, hi. And just tell us a little bit about your first day in the office and why you initially came in.
Yeah, so I first came in because I started suffering from a headache back here, and it hadn't gone away in like 2 days, and it was a level like 9 headache. And I didn't really want to go to the emergency room, and I had been doing some research, and it kind of led me to maybe some nerve pain, and maybe that chiropractic care could help. So I called Dr. Raiders like the day of and basically begged for an appointment, and they let me in. And came in with some pretty severe like pulsing headaches in my head. So
Sure, sure.
yeah.
And this isn't this particular incident was something that was with you for a couple days, but
Yep.
headaches have been kind of a part of your life
Yeah.
for a while, right?
Yep.
And how long, when did you first notice your headaches or migraines? Like
Yeah.
when did it first start happening for you?
Yep. So it kind of started a little bit when I was 16, but not anything that like an Advil couldn't help. And then when I first really noticed it was when I was probably around 18, which was my freshman year of college. And I got a first like full blown real migraine, nausea, like light resistant, all the stuff didn't go away with Advil and just kind of had to stick it out.
Sure. And so headaches and so how many headaches like before you started chiropractic care, how many headaches would you say you were getting in like 1 week?
Anywhere from like 2 all the way to like 4, and I had them before where they've been like every single day of the week, depending on what's going on, whether it's the weather or lifestyle or stress, things like that. So
Sure. And how often
very,
before chiropractic care were you getting migraine headaches?
probably anywhere from like 2 to 7 days. Um,
Okay. So like every 2 to 7 days you were
yeah,
getting at least one migraine.
yep.
Okay. Okay. And so just describe to everybody just a little bit about how things have changed since you started care. And you started how many weeks ago?
Probably about 3.
About 3 weeks
Yeah.
ago. And how have things changed in that 3 week time span?
Well, it started a little slow, but I was like, why not just try it anyway? I mean, it's better than taking medicine every single day.
Sure. Sure.
And it progressively got better and better. And then last week I didn't have any headaches.
Yeah.
I would maybe wake up with a little like fuzzy like brain fog is kind of what I think of.
Sure.
Um, and then it would go away and it hasn't come back really since. So
Yeah.
in
So
the last
you
week I've been clear.
Yeah, so you've gone about a week with no headaches, right?
Mm-hmm.
When's the last time you've gone a week with absolutely
I don't
zero headaches?
I don't even
It's
know.
been a long time,
Yeah.
right? It's been quite a while, and
Yeah.
that's the really the cool part is because the other cool part about this is you were gone last week
Yep.
on a trip,
Mm-hmm.
and on that trip you were sleeping in a different bed,
Yep.
traveling in an airplane, and you do that for work as well.
Yep.
And you know that when you go on these trips, a lot of times that triggers
Yes.
more headaches,
Yeah.
right? And you
Mm-hmm.
have trouble working and you have trouble
Yeah.
doing those things when you're on the road.
Oh
And
yeah.
did you have any of that going on either while you were gone?
No headaches, but I was doing a lot of things that would have triggered headaches. Like we went tubing, we went on a boat, we were sleeping in different beds, we were eating more junk food than normal.
Sure,
We were
sure.
drinking more than we normally do,
Okay,
and that usually triggers all sorts of headaches and
okay.
really nothing.
So drink away. I'm just kidding.
Yeah,
Just kidding. No, but no, that's fantastic though because
yeah,
I just want other people to see that and tell everybody too. And this is just kind of a funny side note is tell everybody what your boyfriend used to say to you about your ailments
yeah.
or your headaches.
He always used to say, "There's always something wrong with you," which
Yeah,
sounds worse than it is.
yeah. Which he was
But
talking about
yeah,
your symptoms
yeah, you're always
or
sick, or you always have a
yeah,
headache, or you don't feel good,
or your energy
something's
level and
wrong.
that kind
Yeah,
of thing, right? And how do you think productivity has changed for you since all this is getting better?
I think it's been a change. I feel more awake.
Okay,
Um, Maybe I just feel more awake because I'm not in pain, so that's probably part of it.
nice.
more, with that comes like more energy. I feel like I'm sleeping better, that kind of
Great.
stuff. So,
That's absolutely fantastic. And
yeah.
just know for any of you guys out there, and I'll let Nikki respond to this one, but for anybody out there that might be on the fence as far as like headaches go, like what would you tell them was, your biggest factor in coming in and sticking with a care plan under chiropractic care
Mhm.
rather than doing what you would normally have done
Yeah.
and taking the Advil every day and that kind of
Yeah.
thing? Like, what would you tell someone who's on the fence?
I think a huge part of it is the medication thing. So I'm only 25 years old, so there's a huge thing where it feels weird to take either preventative medicine every single day or just like a painkiller every day or some sort of like pill concoction of like Sudafed and Advil and like maybe it's sinus related or maybe it's this. And
Sure.
as well as all the medical bills associated with going to different doctors, is it whether it's related to sinuses or is it your
Yeah.
neurologist or is it just like your stomach or like
Yeah.
what is causing like these headaches? I mean,
Yeah.
I did everything from purchase a brand new mattress to new pillows
Yeah.
to buy a fancy air filter. I
Yeah.
had
Trying everything,
yeah, I
right?
had like
Yeah.
deviated septum surgery and
Sure.
basically it's kind of like
Yeah.
what do you have to lose?
Yeah. Well, and you've gone the neurology route
Yep.
too, right? You've gone to the neurologist
Yep.
and what was their recommendation of care for you? I'm just
I've
curious.
actually been to a few neurologists because I could never find a path that I felt comfortable with. Most of them do give you a preventative medicine, and there's anywhere from like pills to shots that you take every day.
Yeah.
And then there's like the pain medicine that you get with that. So it's basically
Sure.
take as needed kind of stuff.
Yeah. And did anyone ever talk to you about the position of your neck curve
Yep.
so when you had testing, like you had MRIs and you
Mm-hmm.
had, I don't know if they did X-rays at all with you. Did they do
Yeah.
X-rays? And did anyone ever talk to you about the position that your spine needs to be in for it to be healthy?
No. The only
Okay.
thing they ever mentioned was that
Yeah.
my deviated septum was crooked and I fixed it and it didn't go away.
Sure.
I
So
mean,
you thought
I
that
can
might have
breathe
been,
better,
yeah,
but
that's great too.
yeah.
But yeah, awesome. And I appreciate you taking time out and just letting other people know who suffer with migraines and headaches in
Mm-hmm.
general, just because it is something that chiropractic care can help with. If you are local and in the Vernon Hills area, like I said, I'm Dr. Nathan Raiders, and this is Nikki, and she's going to continue to get great results. We just have to keep doing the work and get her there. But thanks again, Nikki. I appreciate you taking time out.
Bye.
Yep, thanks.